Dear students, very good morning. In this video, we are going to see about the disaster management cycle. What are the different phases of disaster management? The first phase is mitigation, second one preparedness, third one response, fourth one recovery. So all these four phases comes under the disaster management. Disaster management cycle. See, there are two different management cycles. One is crisis management, another one is risk management. See, disaster impact comes under two different management series. The crisis management consists relief or response, recovery, rehabilitation, and reconstruction, and at last with end with development. Then the risk management includes prevention, mitigation, and preparedness. So as a whole, this is the disaster management cycle. So let us see what is mitigation. Mitigation, the sense we reduce the effectiveness. மிட்டிகேஷன்னா குறைக்கிறது. Mitigation includes measures to prevent the disaster damaging effects of unavoidable disasters. Effective mitigation includes the recognizing and preventing potential technologies disaster and being adequately prepared should such event occurs. To plan effectively for disaster prevention, the need to have community assessment information including knowledge of community resources. See, proper planning before the event occurs or the disaster occurs. Proper planning has to be done. How the disaster to be mitigated. The proper planning and training and how to face the disaster and reduce the disaster. Disaster preparedness. The goal of preparation to reduce or decrease the emergency response time and ensure that necessary equipment is available on site after a disaster. Issues to consider include weather patterns, geographical locations, expectations related to public events and gatherings, age, condition, location of facility and industries to close, proximity to the hospital. So these are the main things to be considered under disaster preparedness. Preparedness include personal preparedness also and professional preparedness also. See how we can have the emergency kit with preparedness plan. Preparedness. The objectives of the disaster preparedness is to ensure that appropriate system or procedure and resources are in place to provide prompt and effective assistance at the time of disaster to the victims, thus facilitating relief measures and rehabilitation services. The following activities are carried out at the time of preparedness: evaluate the risk of country or particular region to disaster, adopt standard procedures and regulations, organize communication information and warning systems, ensure condition and response mechanisms, adopt measures to ensure that financial and other resources are available at readiness, develop public education programs, coordinate information sessions with the news media, and organize the disaster simulation at that to face the preparedness. So this is the preparedness chart. In what ways we must have the preparedness. Next one is response. The response phase is the actual implementation of the disaster plan. The best response plans use an incident command system and relatively simple and routinely practiced and are modified when improvements are needed. Response activities need to be continually monitored and adjusted to the changing situation. So, response phase is the actual implementation phase. That is very, very important. See how the implementation takes place. This picture clearly shows that. So the response continues here in this slide also. Types of information included in initial assessment reports includes the following. What are the initial assessment reports includes? Geographical at the risk, presence of continuing hazard, injuries or deaths, availability of shelter, current level sanitation, status of healthcare infrastructure, everything. Acute and chronic illness can be exacerbated by the prolonged effects of the disaster. The psychological stress of the cleanup and moving can bring about a feeling of severe hopelessness, depression, and grief. So, recovery can be impeded by short term psychological effects, eventually merging with the long term results of living and adverse circumstances. CHN must also remain alert for environmental health hazards. Home visit may lead to nurse to uncover situations such as faulty housing structure, lack of water supply, or lack of electricity. Disaster recovery plan. The time to plan recovery. So, the fourth phase tells us about the recovery. Once the incident is over, the organization and staff needs to recover. The recovery is usually easier if during the response some of the staff have been assigned to maintain essential services while others were assigned to the disaster response. So, recovery begins when the disaster is finished and serves the community, establishing long term medical care for those in need after a disaster, and rebuilding and working to reduce the chance of future. See, after the flood, so flexibility remains important component of a successful recovery operation. Community cleanup efforts can incur a host of physical and psychological problems. For example, the physical stress of moving heavy objects can cause back injury, severe fatigue, and even death from heart attacks. Thank you.